Welcome! This video is an introduction to lifestyle changes as part of the cardiac rehabilitation process. Hello, Mr. Lim. How have you been since your discharge?
Good morning, Joy. I'm doing well, but I want to learn more about my heart attack and how to prevent it from happening again.
Sure, Mr. Lim. That's why you are enrolled in our cardiac rehabilitation program. Today, we are going to learn about how your heart works, why people have heart attacks, and the risk factors that you can change to prevent another heart attack. Let's get started. Ischemic heart disease or coronary heart disease is the third leading cause of death in Singapore. That's why it's important to pay attention to our heart health. Now, let's learn about the heart and what it does. The heart is a muscle that pumps blood around the body, and coronary arteries supply blood to the heart muscle. These arteries run on the surface of the heart and provide blood rich in oxygen and nutrients. Coronary heart disease is what happens when the arteries become narrowed or blocked due to atherosclerosis. Atherosclerosis is the buildup of plaque or blockages within the artery, resulting in reduced blood flow and oxygen to the heart muscle. A heart attack refers to permanent damage to the heart muscle due to lack of blood flow to the heart. It occurs when a coronary artery is significantly blocked, either from chronic blockage of the artery over time or due to plaque rupture with blood clot formation.
How would I know if I have a heart attack?
Heart attack symptoms may differ from person to person. The most common symptoms are chest pain with jaw or arm pain, shortness of breath, cold sweats, palpitations, or giddiness. If any of these symptoms last longer than 15 minutes, you need to call 995. Do not hail a taxi or visit your nearest GP or polyclinic. If a heart attack is confirmed at the hospital, you will undergo an emergency procedure called a coronary angiography to confirm the artery blockage and restore flow through the artery via angioplasty, including ballooning or stenting. However, in some cases when angioplasty is not possible, one may need coronary artery bypass surgery or CABG. CABG is performed by grafting healthy blood vessels taken from your chest, arm, or leg to redirect blood around blocked arteries. This improves blood flow to your heart muscles. Of course, we want to avoid having these procedures in the first place. While there is no single cause for coronary heart disease, there are risk factors that can increase the chances of a heart attack. The first kind are non-modifiable risk factors. These include being male, being older, or having a family history of coronary heart disease. Research has also shown that those of Indian ethnicity tend to have a higher risk of heart disease. Although these factors can't be changed, understanding them can motivate you to take early precautions to reduce other risk factors. Next, there are modifiable risk factors. These are factors that can be influenced by lifestyle changes. The first factor is smoking. Chemicals in cigarette smoke cause the cells that line the blood vessels to become swollen and inflamed. This can narrow the blood vessels and also promote atherosclerosis, leading to a heart attack. To quit smoking, you can try gradually reducing how much you smoke or completely stop. Referral to a smoking cessation program is also available. Being overweight or obese increases your overall risk of coronary heart disease. Ensure that your BMI and waist circumference falls within the healthy range. Cholesterol in the body consists of good and bad cholesterol. Cholesterol is made in your liver, but also comes from dietary intake of seafood and meat. Bad cholesterol deposits fat on your blood vessel walls, which leads to coronary heart disease, while good cholesterol sends it to the liver to be removed. Reduce your meat and seafood intake to ensure that your cholesterol and triglycerides are in the desirable range. High blood pressure and diabetes cause irritation of the blood vessels. This causes damage to the walls and encourages atherosclerosis, which can narrow or block your arteries. Ensure that your blood pressure is within the normal range and keep your blood glucose levels in check. Excessive stress produces a hormone called cortisol that makes blood more likely to clot. Stress may also cause you to develop bad habits such as smoking or overeating to deal with it. The last risk factor is your physical activity level. A sedentary lifestyle increases the risk of coronary heart disease, while an active lifestyle decreases the risk. That's why it's important to exercise regularly, at least 3 to 5 times a week for a duration of 30 minutes each. Coronary heart disease can be managed, and it is important to adopt healthier lifestyle changes to reduce the risk factors that can cause coronary heart disease.
Thanks, Joy. I've learned so much about how to lead a healthy lifestyle. I think I'll start by taking a walk this evening. Today, we learned about how heart attacks happen and how heart disease can be managed by adopting these healthier lifestyle choices.